So, uh, so just want to take a minute and introduce you to our January course for Interim 2021. Just give you some updates on where we're going, what we're going to be doing with this. This is evidence-based practice and clinical decision making. So the idea here is going to be to both learn a little bit more about evidence-based practice and specifically get into that, but really try to spend most of our time thinking about clinical decision making and how we go about making those decisions. So let's go ahead and jump into the course website, and I'll kind of show you through that now. So just like we've done in the past there, I've got everything outlined for you as far as assignments. Everything you want to do should be showing up in your list. If you look at the student view for this, you'll see when it comes up, this is what yours will look like. You'll have all of your to-do list here in the corner as far as all the assignments and everything that you need to be doing on that. And I wanted to give you a heads up on this because we do get started rather quickly on this course. And so if you want to get started before January, that's recommended with that. So this is where you can find the introduction video here. Once this gets posted, with that, a few other things, and then some aspects as far as all of the assignments as it would go. So let's now look at the syllabus because that's where we'll have most of our information there. The list and the actual syllabus is in this aspect, but I also have the course textbooks here with that. If you want to get ahead, it's this Kenbach book that you need right away. And you will need all three of these books. As far as reading and preparing, we will have exam questions out of the first two, and then you will actually be doing worksheets directly out of the Kenbach book. So let's take a look at what our semester together is going to look like. So with this, as it loads, the semester is going to be 100% online. We will have some synchronous sessions, and it's possible we may decide to meet together for that, but we will also have that in Zoom. So the idea here is you should be able to also spend a significant amount of time doing your clinical immersion, because you have 2 credits of clinical immersion as well that you need to be making progress on. So you can see here from the outcomes, looking at the evidence-based medicine, some of the specific components that we've seen and most of you guys have seen before in your research aspects in there. But we're also going to spend some time looking at documentation in healthcare informatics as far as that clinical decision making. Some of the specifics there as well with that. The grades are posted there. They're 750 points. We'll have flipped class reflections, exams, and this semester project. One thing to pay attention with, since this is an online class, I broke out how many hours it's expected to be done. And so this, I'm expecting about 72 hours to complete this course. And you can see these direct contact hours are things that I'm directly asking you to do about how long I expect you to actually have to be working on some of these. And then some of this out of class time is preparation, getting ready, not the actual doing, but the preparing aspects for that. So let's look at what we have. So we have 24 course topics that form the main components with our evidence-based practice units. And so for each of those course topics, there's an associated reading, pretty much a chapter right out of one of those first two books, and then a video lesson. The average of these are about 25 minutes. Some are much longer, all the way up to about 45 minutes, and some then obviously must be shorter, closer to 10 minutes with that. And so you'll have those to watch and the readings to do to help get yourself ready for the exam. On that as well, then, we have these 24 course topics. With that, I'm going to ask that you complete one of those flipped class reflection sheets on the lessons leading up to our synchronous sessions. And so you've done these flipped class reflections before. I will allow you guys for this with COVID and everything else with that. Use these as much as you want to. You can either do a flipped class for each course topic, or you can do it for the group of topics for that, because we'll be only meeting periodically. And so opposed to having to do 24 flipped class reflections, you only have to turn in 5. So you could either do all 24 and bunch them together into those 5 packets, or you can do 5 and cover multiple course topics and multiple video lessons in each one of those 5. But the idea with all of these, the video lessons and the readings and then the flipped class reflections, is to prepare for these synchronous sessions. And these synchronous sessions are going to be on Zoom. Like I said, we might also get together with those. They're an hour long. They're on Tuesdays and Thursdays at 8 a.m. With that, and I'll show you how to get there once we go back to the course aspect. But this is where you have the opportunity to ask questions, and I will go over some of the most important points. Now, it's important to realize that there is absolutely no possible way for us to cover everything in those video lessons in these 5 hours with that. So a lot of this is going to be truncated, so that way you can study the material, do the lessons on your own time whenever it's convenient for you, while still getting the opportunity to ask your questions. And so just think of the synchronous sessions as like the last 10 minutes of every class period, when the professor asks if you have any questions with that. The first 40 minutes of the class period is the video lessons and all that. We then have the exams as well. There are 2 exams. There's nothing cumulative. They're just on their aspect. About the first 2/3 of the class are on the first exam, and the last third is on the final exam. These are mainly going to be multiple choice and true false, sort of similar to what you did in administration class. And then last is this semester project. There are 2 parts of that. The first part of the semester project is going to be doing worksheets out of that Kenbach book. And then the second part, you're actually going to pick 2 separate cases that you're working on in your immersion experience. And you're going to create a documentation and complete healthcare record for those individuals. So let's go back to the modules and take a look at how the course is going to be organized. So each day is going to have the course headlines with there. You'll have course topics. These are the things that get you ready for the exams. Mainly these are the asynchronous portions to that you can do on your own. The due dates are there for each component. Let's move down to this other one because it looks on the 6th because it looks more normal. Here you can see you have readings that you need to do, and I've made those assignments so they come up on your to-do list. And then you also have videos. This one's a little different because it's 2 chapters in one video. Almost all of the other videos are 1 video per chapter. I also include the PowerPoint there for you. You can watch the videos directly within each of these things. They'll just pop up right there. You can watch it. You can elect to watch that on YouTube, change speeds, pause, rewind, whatever you need to do to get ready for the exam, taking notes, all those sorts of things. Make sure you have questions. Work on your flipped class assignment are all good things to be doing at that same point in time while you're watching those. You can click those to be done to also make progress through that. And then you have the semester project. And so you have all of this on this first day with the semester project because we need to get you up to speed on some of these documentation. It all should be review. These are not long chapters, maybe like a page or two per chapter to read, but I do have some readings for you to get ready in the Kenbach book there. And then for each worksheet, these are the names of the worksheets in the course text in this Kenbach book, but I also put the pages listed there for you. Okay, and the worksheets have varying points based on how much work they're going to take. And so each of those worksheets are in your text. You can either copy them if you're sharing a book with that, and then write on them. They're perforated, so you can rip them out, work on them with that. Then you can either scan them, take a picture, and upload them to that as well. And so you can see here the semester project components. All of these first components then are on the Kenbach book. Then you get down here on our first Thursday, which is the 7th. You have your flipped class due. It tells you what video lessons I expect to be included. Since we've only done one at that point in time, it's just video lesson 1. Other times it will have what video lessons it needs. Like I said before, you can either do one for each video lesson or you can combine them into one larger one with that. Then the synchronous sessions are there as well. Like I said, these will be on Zoom. All of the invites are already there. You can go ahead and go in through this. You can go in early if you want to and get the link and add that to your schedule so you have that, but the meeting ID, passcode, and everything will be there. They're different for each synchronous session just so it's easier to put on your calendar if you want. And then coming down to the pseudonym patient assignments. Basically, these are your patients that you're working with in the clinic, and we're going to have you do some documentation on those. And I will have videos for those as well, for some descriptions on that, or we'll discuss them in the synchronous sessions in there. But basically, there are descriptions as far as what I'm looking for with the initial notes, where you should be getting these things as well. But you're going to be picking 2 patients that you're working with and you're actively involved in their patient care, and you're just going to do some documentation. You're going to document an initial visit with if you've been treating this patient prior to this, and so you've been doing on care. I just want you to assume that this is a new examination, so do a brand new examination and document that with all of the different components, and then just include everything that you've been doing, right? That still would be included in your documentation, but you would include that then like somebody else did it and it was a referral. So that would then become in the history section with that. So you have 2 of those that you're going to be doing. You're also then going to do as part of that initial evaluation with that, I ask you to collect a few patient-reported outcome measures So you'll see those listed as well within there, right? So um, find where that is. Right, so initial visit, patient report, outcome measures, you're just going to say which ones you did and why you did that, and then include the filled out version of that. You can just take pictures of that as well. You'll have the second patient with the initial note. Then I ask you to do some daily visit notes. In there as well. So you'll have the daily visit notes for 3 different days of treatment for each of the patients. And then you will have a reevaluation and progress note due towards the end of the semester. After you've been treating them for at least 2 weeks, you will reevaluate them and upload them. The exams are also listed here as well. They become available and you'll have about 4 or 5 days to get that done, but they are due on that day as we continue to move forward rather quickly in a January term. Anyway, much more information to come, but at this point, just wanted to introduce the course so you had an idea of everything that was going on with that. Talk to you later.